our last of the summer. I'm really excited to be able to have Teresa Marteau with us today. She's the Director of the Behavioural and Health Research Unit at the University of Cambridge. And I'm particularly looking forward to this conversation because one of Nesta's 3 missions is called A Healthier Life, where the big focus is on tackling obesity. So I'm sure we'll learn a lot from Teresa over the next hour. We're also talking to Teresa at a very topical moment because just last week, Henry Dimbleby published his National Food Strategy, the second part of that, with quite radical proposals around a sugar and salt tax. And I think quite a lot of what Teresa will say today will have bearing on both why some of those proposals might or might not be sensible, but also the political and public acceptability challenges in getting those agreed. So without further ado, I'll hand over to Teresa, who's going to say a few words to open up with a few slides, and then we'll dive into some questions. Please do put your questions in at any point, and I'll try and draw on them throughout this conversation. Teresa, welcome.
Thank you very much, Ravi. I'm delighted to be here. As you say, I'm just going to open up with a few comments accompanied by slides, which Christina is going to show for me. So thanks very much, Christina. Changing behaviour. I have 3 things that I would say. Changing behaviour at scale. First, it's difficult. There is no one way of doing it, but there are less and more effective ways. These 2 papers shown here summarize some of the evidence on changing the 4 sets of behaviors. So smoking, behavior related to diet, alcohol consumption, and physical inactivity that contribute most to shorter lives and lives lived for more years in poor health. Next slide, please. One of the more popular ways of attempting to change behaviour has been to communicate risk information, to provide risk information. So while this is generally pretty good at increasing our awareness of the risks that our behaviour can pose, it's generally insufficient to change behaviour at scale. So that's led people to start thinking about personalising risk information. Next slide, please. And there are many ways in which this can be done, particularly giving people personalized risk information based on some biological indicator of risk. So one example of that is genetic risk. And there are many companies, I don't have shares in this particular one. The idea is that in exchange for a sample of saliva and £100, I think last time I looked, you could find out your risk of developing one of the common chronic conditions, such as type 2 diabetes, and be given information on how any of the risks that you are informed that you personally have might be reduced. And spoiler alert, it's going to be about moving more and eating less. So the big question is, does that kind of personalized risk information, together with information on how to reduce the risk, change our behavior? Next slide, thanks. So we've looked at this in several big trials and brought the literature together. And what this shows is that communicating genetic risk information does not change behavior at scale. Now, you might think that is because of fatalism from genetic risk information, but there are 4 other studies that contribute to the evidence base. And these 2 show that providing people with personalized risk information generally has little or no effect on their behavior. If you could, thank you. Just keep that slide there. Sorry, go back. If you could go back, thanks. Just keep that slide there for a moment. And just to say that this information, while disappointing for some, is actually extremely important, because what it highlights, along with other evidence, is the importance of environments in shaping our behavior, often without our awareness, with environments having a much larger impact on our behavior than any intention to change our behavior, particularly the kinds of behaviors that we're focused on in this work. So next slide, please. This slide is top level. I'm not expecting you to read it. Summary of the evidence that a group of us brought together 2 years ago now to look at what are the most effective interventions together that could change the four sets of behaviours and do so in a way that could reduce health inequalities. The set of interventions for which the evidence is strongest and for which the evidence is showing the largest effect size are the fiscal or economic ones, and we can come on to discuss those, but those are generally sort of tax-related, would include tax interventions. The next set of interventions are marketing ones, which generally involve restricting marketing and promotional activities. And then the third set, a very loose, sorry, go back, please. Sorry, thanks. A loose set of interventions, generally called availability, which involve removing products and activities that harm health, and replacing them with those that don't. So I'm just going to illustrate a couple of those and focused on those that contribute most to obesity, which, as Ravi has mentioned, is a particular focus at the moment for Nesta. So first of all, fast food outlets. The density of fast food outlets is strongly correlated with areas of deprivation. And we also know that obesity is patterned by areas of deprivation. Now, additional work has shown that both exposure to fast food outlets and low income independently are predictors of being overweight and obese. So those on the lowest incomes who are living in areas with high density of fast food outlets, if you like, have a double hit. What we don't know is by how much the density needs to be reduced to have an effect, a measurable effect on population health, in this case, overweight and obesity. And in the next two slides, I just want to show you the results of some interventions which have been conducted in my group, which look at changing some aspect of, first of all, the food environment and then the alcohol environment to look at the potential for reducing intake. So in this example, hard to read, it's 19 worksite cafeterias they were distribution sites for a major supermarket group in the UK. And what we did in those worksite cafeterias was to reduce the relative availability of higher energy food. So the menus and the food that were available were shifted. So the higher energy foods were replaced with lower energy foods. And for the higher energy foods, we also reduced portion size. And this is an intervention that was conducted over a 6-month period. And I just want you to look at the two bars on the left-hand side, which show the change with the horizontal bar being a no change compared to baseline. And if you could click, thanks, Christina. What we've shown overall is what we were measuring is not at an individual level, but at the cafeteria level, the change in the energy that was purchased per day. And so if you reduce the relative availability of higher energy food, then you get a reduction in the energy overall that's purchased in the cafeteria of just under 5%. And then if you add to that, as I said earlier, we're not looking at interventions on their own. So here it's important to look at what the additional impact would be of reducing portion size. We get an additive effect. So these are promising results and build on previous smaller scale studies. The next slide is focused on alcohol. We know that amongst adults who drink alcohol, energy from alcohol, so calories from alcohol, can contribute between estimated 4 and 10% of an adult's energy intake. Consumption of wine in this country has increased enormously since the 1960s. We were interested in looking at just one of the cues that might affect consumption, which is wine glass size. And as you can see from this figure, wine glass size has increased over the last 3 centuries in England, but it particularly increased, they doubled in capacity from the 1990s until now, with the average wine glass having a capacity of just shy of half a litre, so it's around 450 millilitres. So the question is, does that affect how much we drink? If you could click, Christina, thanks. We've conducted various experiments in 5 restaurants and bars, bringing together 8 data sets. What we were able to show was in restaurants, but not bars, where wine is served with a smaller wine glass, so 300 milliliter compared to 370, then the amount of wine that's sold is reduced by around 7%. And that is an effect of people pouring more into the glasses from bottles. So these are just two examples. We need all the interventions in the table that I showed you in order to make an impact on population health, including obesity. And yet few of these policies appear. So why is that? One way of looking at this was proposed in a Lancet commission on the global syndemic of climate change, obesity and malnutrition. And they identified 3 particular barriers: inadequate political leadership and governance, that's not just in the UK, to enact the policies, and strong opposition to policies by powerful commercial interests, and finally, lack of demand for policy action by the public. I just want to say a little bit about the last 2. Christine, if you could just thanks. The activity of powerful commercial interests that have much to benefit from the status quo is captured well, I think, in the book, The Merchants of Doubt, where activities in the fossil fuel industry and tobacco industry, principally undermining the science and undermining the scientists, have been an activity engaged in for some decades. And on the far right-hand side, I've just got some images of adverts that were taken out by different industry groups at the prospect of government during the coalition years proposing policies. The top one was standardized packaging of tobacco that eventually was instituted. The second one is from the alcohol industry on minimum unit price, which in England we still don't have it. And the bottom one was the beverage industry, the soft drinks industry, at the prospect of the soft drink industry levy. Next, thanks. Also important in this is public acceptability, and going further than that, actually public demand of governments for policies that can be effective in achieving health, which we know is something that populations value. And just to say that the support for government intervention to change behaviour is gendered. It's higher consistently across studies amongst women. We can talk more about that. But it also varies with effectiveness, perceived effectiveness, and perceived fairness. I'm just going to say a little bit about perceived effectiveness. Next slide, please. What we know is that, as I mentioned, government, there are a number of different policies that government and others might use for changing behaviour, ranging from providing information, changing environments, taxation. Next slide, please. And what we know is that acceptability, generally, populations are very happy to be given information. It will have little impact on their behaviour at a population level, but they're very happy for that, but far less happy about the kinds of policy interventions such as taxes and changing availability. And the unfortunate thing is that this is, broadly speaking, inversely related to the potential, the effectiveness of these policies to change behaviour. So in looking at this, I mean, these are associations. So the question then is, to what extent might one be able to shift acceptability by providing evidence of effectiveness? And this is something that we've looked at in several experiments, but the strongest evidence comes from systematic literature review. Next and final slide, please, where we looked across policy domains for experiments that have been conducted in which people have been presented with evidence of a policy effectiveness or ineffectiveness compared with a group that hadn't. And across 36 experiments, now 20 were in the domain of health, 9 were in the area of the environment, and 7 were a mixed number of policy domains, gun control, education. You can guess some of the provenance of these studies. And what these show is that when people are either told, so just asserted, or shown evidence of effectiveness for these policies, support for the policies can increase. And we estimate that from these studies, it increases by around 4%. And importantly, when people are presented with evidence of ineffectiveness, which a few of these studies did look at, policy support decreases by a similar amount. Now, this is in lab-based studies settings. And so, of course, we don't know how well these kinds of messages will endure in the real world, where there are many stronger counter messages. So I'll leave it there, Ravi. And just to mention that Nesta have done some interesting work on perceived effectiveness and public acceptability of policies. So you might want to pick up on that as well as other things. Thanks very much.
Thank you very much. That was great. Full of stuff that we can dive into now. I'd actually like to go back to the beginning where you started talking about why just telling people about risk doesn't really tend to be effective, either general risk or even personalized risk. I guess the first question is why? Why does it not have an effect? And is it true for other risky behaviors?
Yes. So I'm talking about behaviors that tend to be pretty routine. So the 4 sets of behaviors that I talked about. So smoking, excess consumption of calories from food, alcohol consumption, and physical inactivity. Now, if we think about other behaviors, and one that I've used, which the image for on the first paper shown in the first slide, if you put up a notice saying sharks don't swim, people are exquisitely sensitive to that information. So one set of reasons is that very often one is presenting people with information about a threat that is far in the future. It's uncertain that if you change your behavior, you would benefit from that, and asking people to swap, if you like, behavior that in the short term gives them pleasure with certainty. So that's one set of explanations. The other is that some people will increase their or strengthen their intentions to change their behavior when they've been given the kind of risk information, personalized risk information I was talking about. But the environments that in which we're living are so strong that it becomes really difficult for people to act, if you like, sort of swim against the tide of the environment. So those are just some of the reasons why providing risk information and information on how to change your behavior in an environment that is strongly enabling the unhealthy behaviors is not effective. Now, that doesn't mean to say that providing this risk information is never going to be helpful. My impression, just based on a couple of papers, is that if you can change the environment, then the risk information is then going to be much more useful. So there's some evidence in smoking that quit attempts where people have successfully stopped smoking, they're more likely to endure where people don't live close to a tobacco outlet. So
is that almost suggesting that this information can have a little bit of an effect, but when it's faced with such an overwhelming set of pressures to do the wrong thing, it's not going to be enough. But when that goes away, then maybe it can start to reach a tipping point.
Absolutely, absolutely, yeah.
And I guess the other question I had was in relation to big marketing campaigns to address tobacco use, for instance, all those front of pack labels. Perhaps it didn't have a big effect on people's consumption habits, but did it start to change the public debate about how smoking is bad and therefore enable the bolder measures that were taken later, such as the public smoking ban, to be enacted? So is there another reason why information on risk can be useful, even if it's not the immediate behaviour change from consumers?
I think that's absolutely right. I mean, that's my impression. It's hard to imagine how you would generate the evidence on that, but I think that it has a very important role in that, in providing support for governments to enact more effective policies. Yeah.
And before we sort of throw information in the bin completely, I just wondered whether some of the experiments that involve a particularly credible messenger or doing it at a particularly salient moment in your life, for instance, very recently with COVID, I imagine would have been a good time to communicate about these things, given the effect that obesity was having on COVID rates, on severity of COVID. Is there any evidence to suggest that those sorts of things and presenting the information in a very visual way can make a difference, or is it all small beer?
I don't know, and it is interesting that we had an obesity strategy last July on the back of COVID, and I think there's another one coming out quite soon that builds on that. I could see how it could work in either way, because it may well be that people are much more alert to the problem, but unless we change the food environments in which people are living, and obesity is heavily socially patterned, so we already have disadvantage in those communities, and so without doing much to alleviate that, I'm not sure how effective an obesity strategy would be that doesn't address some of those environmental drivers. The other point to mention, based on only 3 studies, because that's all I can find, and they're not experimental studies, but thinking about tackling health inequalities as and in particular poverty as a way of trying to change these behaviors. 3 small studies, one in the UK, one in the US, one in Canada, that if the incomes of the poorest households are increased just a small amount, then in one of the studies, purchasing of the amount of money spent on fruit and vegetables went up, and in all 3 studies, the amount of money spent on tobacco and alcohol went down. So that is slightly against dominant thinking, and people don't know the mechanism, but it's thought that alleviating the stress of poverty actually does quite a bit, particularly in the poorest households, of freeing people up to be able to think about futures. But I would still go back to it may well be a good time, but I think it's a good time for effective policies that are tackling the environments that are driving the problem.
That's fascinating, Teresa. It echoes some of the findings internationally when you give people cash transfers. Lots of concerns that if you give people cash transfers, they'll spend it on exactly the things you mentioned, but actually all the surveys suggest it's well spent and it's effective, but it's amazing how strong that concern remains. There's a question from Javita Lung about whether this effect is the same across different ages. So, for instance, are adolescents more likely to take risks and therefore perhaps be less open to this? And I just wanted to broaden that question out to the variations between different classes and different ages. Are there any differences that are notable?
What in?
So I think what I was trying to get at is that presumably consumption patterns of food are quite different given the big health inequalities that we see, and that there's a sort of very regressive social gradient that you mentioned. So why is that? Is that just a function of what you were saying before, which is about money, and is it driven by that, or are there other reasons why there are big variations by socioeconomic group?
So there'll be many factors, and so one of it is money, but working in ways that isn't straightforward, as we've just discussed. The other is the environments, the physical environments in which people are living. And I think that that's shown by the density of fast food outlets, that you've got a sort of double hit for those individuals who are most likely to be obese or overweight. There's you mentioned the National Food Strategy led by Henry Dimbleby that was published last week, and I'd highly recommend that people look at that, and the evidence pack associated with that is absolutely, it's just fabulous. And in there they document the costs of healthier diets. So it does cost more. So that's another factor that's going to feed into this. There are also social and cultural differences that may well feed into this. We've also got the effect of social norms. People around you are doing these, engaged in these behaviors. It makes it more likely that you engage in them. Question, are some of the interventions that I've talked about, where you're trying to change cues in the environment, or change what's available, does that differentially affect those who have most to gain by changing their behavior? In terms of the evidence base, it's hard enough to design the study to find the main effect without being able to disentangle and look at the impact on different groups. But where people have looked at fiscal policies, for example, for smoking, these interventions have most effect on those who are poorest. So they are non-regressive in terms of impact on behavior. And I was looking recently at the evidence on minimum unit price for alcohol. So again, another report actually published yesterday from the Chief Medical Officer, Chris Whitty, on health in coastal towns, and two of the behaviours that I've mentioned that are particularly important there in explaining the very, the lower life expectancy and the many more years lived in poor health, are both tobacco and alcohol. And minimum unit price, which was introduced in Scotland 2 years ago after a long battle in the courts, and in Wales more recently, the analysis is showing that increasing the price by about 7% reduces consumption by about 7%, and did not lead to lower income households increasing expenditure on alcohol. So what it did was it had a positive effect on those who were drinking most without being regressive. So I think it depends on what the targets are, and also how the policy is designed.
But alcohol's an interesting example of how tastes and preferences change and differ across countries. We actually understand, for instance, why those habits change over time, and is that a sort of potential way to intervene that's perhaps less structural than some of the suggestions that you outlined towards the end of your talk?
Yeah, I don't know, possibly, but trying to engineer social and cultural change, you know better than me, but
yeah.
I'm not sure how easy that is. What we do know is price is one, it is an important driver, and minimum unit price was resisted through the European courts by the alcohol industry. And we've got good evidence that it's not a panacea. There is no one intervention, but this is an intervention that does reduce how much people consume.
So you, some of the suggestions you had were around reducing portion size and changing the availability of produce. Obviously, that potentially runs up against commercial interests that you also mentioned as a major blocker. Are there ways of getting supermarkets and food producers to embrace this in a way that is in their financial interest? And I guess in some areas, it actually might make them more money if they can sell the same product that's make it slightly smaller at the same price. But there are definitely potential tensions that would make a supermarket, for instance, not go with what you're suggesting and make healthier foods more prominent in their supermarket aisle. So what can we do on that?
I think two things spring to mind, and this came out in the point that came out in the National Food Strategy last week. Henry and his team talking to many people, including those, the retailers, and they were calling for, and this is not the first time, regulation to have a level playing field. So I think that is certainly something to think about, because we've seen that voluntary agreements actually don't work, because there's a first mover disadvantage rather than most likely. I think the other area where we could think more is about having in the public sector, and I know that the public sector and private sector, they're not completely separate spheres, but I think we've missed an opportunity, but it's not too late to take it, to have to model what a healthy, and I think we should say a healthy and sustainable food environment looks like. So we've got government food buying standards, and those are it's recommended that they change to shift the amount of the food that's purchased out of the public purse that's healthier and sustainable. I don't know why out of the public purse we don't just buy healthy and sustainable foods. Looking at hospitals, there was quite a lot of energy expended a few years ago now talking about having a tax on sugary drinks sold in hospitals. Why on earth are we selling sugary drinks in hospitals? Now, NHS Scotland has got, I'm not sure on the precise regulation, but they have a system in place whereby outlets in property owned by NHS in Scotland have to sell the proportion of food that's sold that is high in fat, sugar and salt can't be higher than 50% for food and can't be higher than 30% for drinks. But as I say, why don't we go for 100%? And it's not just about the content, the nutritional content, it's also about the portion size. So wouldn't that be fabulous? I mean, none of us really know what a healthy and sustainable food environment looks like. So we're missing that opportunity. So that is where I would encourage people to be much more radical. I don't know if it's something that Nesta might think about wanting to partner with some organizations. They don't have to be public sector, but organizations where the public goes in
Yeah, I think it's a huge opportunity, particularly around public sector procurement and almost treating it like a big challenge prize, which is one of the things that Nesta does, to say, how can we make all of our food environments that the public sector has some control over, ones that are health promoting. You talked quite a bit about the sort of public acceptability of these different measures and the political challenges that are connected with that. And there's this graph that you showed about how the most effective interventions, like things like the sugar tax, are also the least publicly acceptable. As you mentioned, we published some research with the Behavioural Insights team, which suggested that not only are they seen as not very acceptable to the public don't think they're effective. So even the things that are the most effective, the public think are the least.
Yeah.
Now, I don't know whether that's driven by or driving the lack of public acceptability, but I thought it was an interesting finding. I just wanted to get your take on it.
I think that's absolutely right. So as I was trying to say, it's correlational. So it may be that it's part of a cognitive consistency effect. So I like this. and therefore all the other things I like go with it. So most of all, we do know that people like effective policies. So it may well be that, I like this, therefore it's going to be effective. The important thing, though, is with the experimental evidence, you can shift acceptability by asserting or showing evidence of effectiveness. I'm not really too sure what that's based on, because we've done several experiments looking at, if you just give one sentence, which is, this is an effective policy that could help tackle childhood obesity, versus giving a very detailed infographic showing by how much, the sentence is as effective as the infographic or giving any numerical information. So I think we need to understand much more about this, about what can increase public acceptability. But I also think that this is still thinking about it in quite a linear way. And as I think more about the challenge, people, this is a pandemic, a global pandemic of obesity, and that's how we talked about it before, the current infectious disease pandemic. It's a major challenge, but it's also linked to the climate change challenge. And I think there could be some promise in trying to link those more explicitly, both by policymakers and helping the public to see the link. So the global food system contributes most to biodiversity loss. People care about that. And it's the second only to energy in terms of carbon emissions. And yet, we're hearing all the time about electric cars, which is fine, but it's our food system, and it's our food system, as the National Food Strategy was attempting to communicate, is making us sick and wrecking the planet. So being able to link those, I think that could be an opportunity. I mean, the other thing I feel quite strongly is there isn't an articulated roadmap, for want of a better word, or vision. So, we all know about net zero 2050. By how much do we need to change these behaviors to get there? Actually, probably we should be going for 2030, but that's another story. And if we think about obesity in our population, we've had umpteen policies, I think nearly 700 detailed policy details over the last 30 years. So work from my colleague Donny Theus and Martin White in Cambridge. And obesity rates have just gone, up and up. So whether we talk about leveling, but actually articulating what it is that we need to happen. And I think people are really concerned that there's a population level concern about obesity in children, regardless of whether it's your children, but the next generation being obese. And so the extent to which there could be a stronger vision and roadmap, maybe again that I don't want to dump everything on Nesta, but this involves engagement of publics as well as the policymakers, as well as industries, industries of yesterday and industries for tomorrow, just trying to articulate that. Because I'm sure if people, it's one thing to have a sense that, increasing the price of a sugary drink can be effective in reducing the amount of sugar and therefore tackling, contributing towards tackling obesity. But if we really do want to have healthier populations, we need far, far more than that. We need all these things together. And I don't think that's a message that anyone's attempted to communicate to the public. I could be wrong.
And by a sort of roadmap equivalent to net zero, are you saying a roadmap to take the average amount of calories consumed or sold out over time by 200 calories or whatever it is per person over a certain amount of time? How is that what you're looking for, or is it a vision of how our food environments look, or a bit of both?
And more.
Okay.
So if we're looking at, I think inequalities is absolutely key. We need to be tackling those. In the context of net zero, people are talking, just transitions is what needs to be thought about. And I think going back to the National Food Strategy last week, it was disappointing to see it dismissed so readily by the PM, who clearly hadn't read it because he was still talking about physical activity, whereas Henry had quite a nuanced message about that. To see it so readily dismissed about for being regressive, hardworking families, and that absolutely wasn't what was being suggested in quite a complex proposal on pricing. So I think we need to be much more careful in terms of how we do manage to communicate this. So, as I say, a just transition, something that is perceived to be fair as well as effective. And the perceived, I think one of the major injustices that people are beginning to realize, and it speaks to the levelling up agenda, is the gross inequalities that exist at the moment in the UK, illuminated and exacerbated by COVID. So I think the roadmap does need to have something that's going to tackle poverty and inequality, as well as, so that won't get you all the way there in terms of tackling obesity, or get you some of the way, as well as the other components.
So you mentioned childhood obesity and how that's actually been quite a good inroad politically, because everyone can get behind the need to tackle childhood obesity, and that's then a way of probably tackling things more broadly, because actually families eat together and it affects a broader range of people. I just wanted to pick up from a comment from Maddie Maplethorpe here, who says, we need to get it into the education system. Kids are great ambassadors for this and can change parental behaviour. But they then call it brainwashing and ends up on the front page of the papers. I just wondered whether there's anything more you wanted to say about, the entry point via children, and including the education system, actually.
Yeah, I think it's really tricky. Because there's potential for stigmatization here. So one entry point in the education system, thinking about an effective intervention that was, I think, introduced into the Republic of Ireland, but beyond pilots, I don't think we've done anything here. And the National Food Strategy is suggesting something similar. The Food Dudes program, so that dates it, but it was a very detailed program developed by behavioral scientists in Bangor, in which, the difference in fruit and vegetable consumption between the poorest and richest households is one of the biggest discrepancies that we have in food. And even making available free fruit and vegetable, free fruit in schools has a limited impact, because tastes are developed very early on. So in this program, fruit is introduced, and the children are exposed very, age 4 or 5 to it, and reinforced by the teachers. There's more fruit and vegetables in the food in the school, and there's a parental program as well. And a year later, the amount of fruit and vegetables in at that time, the lunches that children brought to school, is still higher in those who've been exposed to it. So I don't know that it's so much changing the children to change the parents, but working at a family level within schools with sufficient resource can have a positive impact on diets. But it's still a big struggle unless we're going to change the broader food environments and tackle poverty. So I think we need to do those two alongside it. But that's where I would go for an effective intervention in schools, not precisely education, but behavioural programs for which there's evidence of effectiveness.
Great, thank you. A question from Martin Price, which is about what we can learn from the introduction of seatbelts, the unacceptability of drink driving, and the introduction of the smoking ban in public places.
So what can we learn from those? That it's an iteration between having enough public acceptability and then there's a regulation, and there's evidence to show that people's the acceptability of the intervention can then increase. So it's a good question. It's about finding the sweet spot, because what it shows is, well, it echoes some psychological research that often we think attitudes drive behavior, but very often it's our behavior drives our attitudes.
How do we, so this is a common question that we wrestle with in other fields, like on climate change, we might need to ban people buying boilers, or on food you talked about before, we might need to sort of encourage less meat eating. How do you take that point about actually sometimes you can push the boat out and the attitudes follow the behavior that you've mandated, but the opposite is you could just create a massive backlash and set the whole thing back a generation. And from a research perspective, is there any way of getting a handle on how to calibrate the degree of ambition on regulation?
It's really tough, because I don't want to be special pleading, but for instance, the study that I showed where we looked at 19 work sites, that's only one study, but that takes over a year of quite a team to be able to generate that. And we had reduced availability and portion size respectively by about 25% and 10%. So you then want a whole series of studies where you go larger. So in several studies now, both looking at reducing energy density of food that's available, and also in a series of studies conducted by a then PhD student, Emma Garnett, looking at increasing the proportion of food available in college cafeterias that are plant-based. Effectively, if you go from 3 out of 4 meals being meat or fish to 2 out of 4, so you've swapped it by a bit, you can make you don't reduce the number of people going to the place to take their food, and that had a 14 percentage point shift in selection towards plant-based meals. So you then want a follow-up study where you say, okay, well, let's make it 50%, let's make it 75%. So I would say, but as a behavioral scientist, I would want the evidence where you've shifted availability by increasing amounts to look at where you get some sort of backlash, but also noting where it is we need to get to, because if changing by 25% gets a change, but actually we need to go to 75%, that then becomes relevant to a question: how do we get to 75% in an acceptable way without backlash?
Great. I just want to pick up on some previous questions, which are about international examples and what we can learn from them. So I think one person asked about Scandinavia. So Margarita Madrid asked, can we learn how other countries drive change? Scandinavian countries use alcohol prices. And I think Maddie Maplethorpe also asked about what we can learn from Australia, where she says you can't buy alcohol in supermarkets. So just more general question, what can we learn from other countries and what they've done well? Well,
exactly that. So thanks for the question. And the table that no one could read that I showed, which showed the interventions for which there's most evidence of shifting behavior to improve population level health, is based on the international literature. And that's exactly what the international literature shows us. So in fact, the point of that table in that paper was actually driven by me writing to the then Secretary of State, who had produced it wasn't a white paper, but a think piece called Prevention is Better Than Health. And center stage was predictive prevention. So it's the first time I've ever written to a Secretary of State. I felt somewhat emboldened because I'm the Director of Studies at Christ College, where he did briefly study. Pointing out to him that while it was a laudable ambition, the evidence told us with quite a degree of precision, he was never going to get there with that intervention. And all credit to him, he wrote back and thanked me for offering to put on a seminar. So we did do that, and we gathered together, and it builds on international literature of the kind that's just been mentioned in Australia and Scandinavia. And that is the value of synthesizing existing literatures. Now, obviously, it would depend in part on, there'll be cultural context, but nonetheless, those show that availability, whether it's in time or space, and pricing are the two most effective sets of interventions.
So we're coming to a close. I just want to take one or two more questions. One is about the framing of this issue around one that requires personal responsibility. So tickety-boo, do you think there's an impact of stigma against those living with obesity, perhaps encouraged by the focus on personal responsibility, on the acceptability of policy?
Yeah. So I'm not entirely sure on the question, but certainly personal responsibility, it's something that is stressed in some of the framing from the industries that are very keen not to have effective policies in place. Say, not only can personal responsibility increase stigma, it's also an ineffective way of shifting, of tackling the problem across populations. So it's got a double problem, I would say. It's ineffective and increases stigma. So, but also, people should watch out when they can see industries saying, oh, this is about personal responsibility, we just need to communicate the information more clearly. Also, I noted with interest that a spokesperson for which industry it was, soft drinks industry, I think it was, talked about how the National Food Strategy is going to go nowhere unless we tackle poverty. So one has to, as I say, the important thing in this area is that there is no one thing, but there are less and more effective things.
That's a good use of whataboutery by whoever said that, because it's both true, but actually a way of them disguising their own responsibility. So just one final question for me about reformulation. So if we think that sugar taxes, salt taxes, advertising bans, all of these things are partly about driving reformulation, I guess there's two questions here. One, how far can you get with that approach? To what extent could we almost stealthily change the recipes of foods, marginally shift portion sizes, and get enough calories out of our diet? Or is there more that we need to do to actually shape choices by individuals, including by the food environment? So, and that's possibly a sort of food science question as much as anything, because maybe there's more foods where it's more difficult to reformulate than others. I think a linked question is any unintended risks from any of these policies. So one unintended consequence might be that you see substitution of ingredients for things that are harmful or calorific, even though they're not sugar or salt. But is there anything we need to be watching out for as we push on sort of more radical policies like the ones you've suggested?
I think it's not credible scientifically and morally to be talking about health outside of sustainability, given we're in a climate emergency. So highly processed foods, because I think that's what you're talking about, are part of the problem. And say, while reformulation will get us so far, and probably we've got the early wins, or maybe some of the fewest, the largest wins that we would get with sodas, actually, why not drink water? And there's a limit as to how far one can go. So yes, it's part of the package, but actually it's about shifting diets to plant-based diets, but also plant-based diets that are not highly processed. And I think that's where we need to go. So I wouldn't hitch my wagon to that entirely. Yeah.
Teresa, it's been fantastic having you on Leicester Talks too. Really, really interesting. Thank you so much for all your work, and we look forward to talking to you again sometime soon. Thank you.
Thank you very much.
And thank you everybody for joining us, and have a very good summer. Bye bye now.